thanks for tuning in to Shannon and Veronica Know Everything. So today we're going to be going over nephrolithiasis, kidney stones. When we're talking about kidney stones, it's important to know that there's also uterine lithiasis, which is ureter stones, and cystal lithiasis, which is bladder stones. But today we're just going to be focusing on kidney stones. So the signs and symptoms, I forgot to write them up here, but it's going to be colicky flank pain. So it's going to come on all at once and be severely painful, but then it goes away. So you'll have some people show up in your ED and say, I feel crazy, the pain went away, I don't have it at all. But that might be an indication for a kidney stone. And then it's also CVA tenderness. So if you remember, you just go and do pretty solid thud, that should be extremely painful for them as well. So moving on, the causes of kidney stones is dehydration is the main cause. A good thing to remember is a white computer programmer guy in the South, because people in the South are the most likely to get it. And I don't know if people who are white get it more, or males, I think probably. And then I know a sedentary lifestyle can predispose you to kidney stones, so that's a computer programmer thing. So a diagnosis, you're gonna run some labs and then a non-contrast helical CT. So it's non-contrast because contrast makes things white and kidney stones are white. So if you had contrast, you wouldn't be able to see them. And it's helical because you want to go all the way around the body, because it could be in the front of the kidney or the posterior part of the kidney. So the treatment is going to be depending on the size, which you get from this CT scan. 5 millimeters is a big thing to remember. So if it's less than 5 millimeters, there's about a 90% chance that a patient will spontaneously pass it on their own. So you just have to give them pain meds and antispasmodics, which is just kind of like a different type of muscle relaxant. Flomax is actually a type for this, but there's kind of questionable efficacy about that. So mostly just pain meds, hydration. If it's greater than 5 millimeters, it cannot pass on its own. So they're going to need surgery, or you're gonna have to do the shock waves to break the stone up. So if you're gonna do surgery, it's called a basket retrieval or ureteroscopy. So I'm not totally sure, but I think you just do a scope up through the ureters, like a little flexible one. And then with the shock waves, so we have, if it's less than 2 centimeters, so that's 20 millimeters. So remember, greater than 5 but less than 20 millimeters, you're gonna go for the extracorporeal shockwave lithotripsy. So it's essentially we send shockwaves into the body and that'll break up the stone. So however, if it's greater than 2 centimeters, which is 20 millimeters, then the shockwaves aren't gonna be able to break it up and the surgery might not be that efficacious. So you're gonna have to do a percutaneous needle lithotripsy. So that's when you go in through the back, percutaneous through the skin, and you take a needle and have to surgically break up the stone. So that was the treatment. Remember, 5 millimeters, if it's between 5 and 20, consider extracorporeal shockwave lithotripsy. Greater than 20, percutaneous, and then either one you can probably go to a basket retrieval. Types of kidney stones, the most common type is calcium oxalate. If you ever forget that, COX are common, calcium ox. The most common type in people who are pregnant is calcium phosphate. I remember P and phosphate for pregnant women, and then uric acid. In our notes it said people with metabolic syndrome, which is like glucose, BMI, triglycerides, HDL, make you prone to uric acid stones, but also people with gout are more prone to uric acid stones. So the treatment is the same as you treat uric acid with allopurinol. So to review, kidney stones, it's pretty hard to miss on a test. It's just colicky pain that comes and goes, and then 5 millimeters will guide you in your treatment. Thank you.